What's the future of health and medicine? Well, technology is increasingly bringing the future faster than we think. I'm Dr. Daniel Kraft, founder of NextMed Health and Digital.Health, and today we're exploring the art of the possible and what's coming next in health and medicine around the planet. As we look to 2050, I'm hopeful we'll have a completely different world of medicine, actually more one of true healthcare rather than our sort of current model of sick care. You know, the way we practice, the way I train, the way we sort of mostly experience our healthcare system or systems is one of very intermittent data, usually still collected in the four walls of the clinic or the emergency room or, God forbid, the intensive care unit. That data is almost always used in a reactive manner. We kind of wait for the patient to show up with a heart attack or a stroke, or in my field of oncology, a late stage cancer. And by 2050, or certainly much sooner, we're going to be in an age of much more continuous data that's personalized, that can be much more proactive, come from us almost anytime, anywhere, kind of our digitome and our multi-other omics collected seamlessly. So from our intermittent reactive sick care model to hopefully continuous proactive healthcare model that can be arguably much more democratized and equitable and accessible to almost anyone on the planet. We're already starting to enter this world of not just virtual or physical, but more phygital, kind of this convergence, including how we interact with our clinicians. Even today in 2024, which used to be the future, you can obviously talk to your clinician on a screen, but increasingly that will be an avatar. That might be a representation of your clinician, your nutritionist, your health coach. Those will be tuned to our particular age, culture, language, incentives, goals, health journey, destinations. 2050, coming faster than we think, I think will be a bit of a blend. I think we'll still really want to have humans in the loop, doing what humans can do best. Sometimes that hand on the shoulder, that eye-to-eye contact, but will be augmented by many other forms of data interactivity tools. I like to say we're not going to be in the Mediverse, but the Mediverse, where I might appear to you in your AR glasses or contact lenses, or your health coach will appear in different forms, overused term, but gamify some elements of care to keep us as individuals much more engaged in our self-care, our proactive prevention, leveraging new tools for diagnostics and therapy. Writ large, where technology is taking us is, from hospital to home to phone to on to even inside our bodies. And that's a huge challenge and opportunity. How much of care really needs to have physical lay on the hands? Certainly it's important. Physical exam skills need to be maintained, like we need to still teach the basics, but a lot of care can be done more remotely, which opens up health access and equity. One exciting area that's still under-leveraged in healthcare today, particularly by clinicians, is the world of, wearables. What's going to be the art of the possible next year or even this year when your patient's digital exhaust from a simple consumer wearable can give you insights into their real-time blood pressure, obviously their sleep, their activity. What's going to be very interesting is not looking at any one spot in time, but the baseline, the changes in baseline from an individual, because we all have different baselines. Part of the physical exam that you'll be doing virtually, and when you see a patient in the clinic, will be to interrogate their digitome. Has their resting heart rate gone up 20 points in the last week or two? Something going on indicates not just sleep apnea, but an impending heart attack or stroke. And we'll learn from thousands and millions of data points and barely these baseline trials. What does that digital fingerprint look like of certain diseases early at stage 0 before that acute event happens? Think about otherables. They're not just collecting data from your wrist, but from your collected home environment, which can be super important to tracking changes in behavior and health. We're seeing these consumer health tech companies start to go from just giving data to the patient, but to giving you insights into medical conditions and allowing patients to opt in to plug those into your EMR. Now we're in an era, very exciting era, where we can make from skin cell or blood cell your own personalized iPS stem cell lines, and now differentiate those potentially into your own hematopoietic stem cells or liver tissue or cardiac patches or neurologic progenitors to manage a stroke or a heart attack or acute liver failure. So I think what seems like a bit of like science fiction today in 2024, in 20, 30 years, we're gonna be in an era where we'll be able to start to look at rejuvenative medicine, maybe doing that in vivo to replace organs or tissues that are damaged by age, trauma, or disease. And that will start to enable folks who might have been disabled but maybe even start to super enable us and give us longer, healthier lives. And the clinicians of the future are going to need to learn how to integrate regenerative medicine-based therapies into their care paradigms. I'm hopeful that we can sort of re-architect our healthcare paradigm to optimizing our health span, making 100 the new 60. Many folks today in their 20s, 30s, 40s, 50s, 60s are being much more proactive in preventing disease and optimizing their health. That will hopefully in 2050 mean we have a much larger, relatively healthier older population. But we're going to need help managing them. And that's going to be through a combination of some robotics, new sort of censored environments, new ways of interacting in the virtual metaverse, and thinking about how our healthcare systems plug into that and get rewarded for keeping people healthier rather than paying for the sick care model. The clinician will certainly have a role. It's just going to change quite dramatically, which will beg the question for our era in the old days of 2024, 2025, who do we choose for medical school? How do we educate them to be ready for 2050? I think we'll choose people differently for medical education. They may enter different paths, but I think we're in reality going to be a world where every clinician, every patient, every human has the world's compendium of healthcare information at their fingertips or embedded in their ring or their augmented reality contact lenses. And so, what we'll need to do for training will be quite different. It's going to be, how do we synthesize this information? How do we help the human in the loop, the clinician, the patient be engaged? How we select the right digitally enabled tools or digital therapeutics, or pick the right CRISPR gene editing element to knock out their disease before they ever have it. So we'll need to sort of be more convergent thinkers. We can also think about who is a public health worker. We all can be turned into them. We can upskill almost any field with a smart tablet and a few sensors. How do we sort of cross-train folks to become public health workers, whether it's for public health, their community, for mental health, and just helping their local neighbors in smart ways, but also seeing and ameliorating signs of infectious diseases, kind of the future workforce that can be somewhat connected and upskilled without having to get a full medical degree or MPH. And I know there's several groups looking at that future of technology-enabled public health. Big disruptions are coming. We're going to need less bariatric surgery and maybe less hip replacements and many other things downstream. And I think in the next 10, 20 years, we're not going to have to spend 45 minutes in an MRI machine. You go to your corner pharmacy, Walgreens, CVS, Minute Clinic, in 10 minutes have your full body scan done, read by the AI radiologist with a human in the loop. Colonoscopies, GI docs might be going away to some of these new emerging other forms of picking up cancers. It's going to change the world of oncology, hopefully, to treating diseases at stage 0. And I think for all of us in the healthcare space, we need to not be often fearful of those disruptions, but think about how do we align incentives? How do we architect prevention, diagnostics, and therapy? It's easy to sort of stay in your lane and stay in your silo and say, don't move my cheese. I like my workflow. This is how I get paid. But disruption's coming. And I think the more clinicians of today and those coming into the future can think about, what are the pain points that I could solve for with solutions that exist today or are coming? How can I be part of that rewiring and reimagination of healthcare writ large? I think the art of the possible in this era of digitally enabled care is quite incredible. The challenge is, how do we integrate that into our workflows? How do we see what's already out there and smartly use some amazing solutions that already exist? And the magic of that is you get clinicians, investors, technologists, startups, all sort of sharing what they're doing at the cutting edge, what's now, what they're sharing, what's near, and what's coming next in the next 5, 10 to 20 years. And that helps inform what you're doing now and what mindsets you need and how you're going to lead your organizations from your small solo practice to an academic center or a pharma company or a payer to build for 2050. I think the opportunity for clinicians today, for folks who are medical school deans, to folks who are early in their training or have been out for 20 or 30 years is to think a little bit exponentially, because the future is coming faster than you think. So be that catalyst for change. Don't wait for the future to arrive. It's up to all of us to bring the future faster and to collaborate on building those solutions together.